Okay, so hi Brenda. I know we've been talking
Hi.
back and forth about doing this for such a long time. Do you want to just
Yes.
start off by how we met and how did all this?
Yeah, I would love that.
Yeah,
Yeah. So I'm Brenda Moorthy. So I'm a physician. I'm actually a breast cancer specialist in Phoenix, Arizona. I've been in practice for 19 years and throughout my years in practice and just seeing patients, one of the things that we kind of just really skim over is the benefit of good nutrition.
yeah,
And I've always felt like, there's something more that we should be able to offer patients, whether they're, high risk for cancer, because the patients that I generally see are patients who are, either high risk for getting breast cancer, or they have a breast problem, or they've actually been diagnosed with breast cancer. And I think all patients really want to know what they can do to be proactive. And you and I met about 2 to 3 years ago when I myself was diagnosed with diabetes. And I had actually seen a nutritionist. And some of my frustrations were basically that, they tell you, okay, eat this many grams of, this kind of food group. And although there are lots of guidelines, I think it's very challenging to put that into practice.
yeah,
So the question of, how do I actually do that? I get what the guidelines are, but I'm not really sure how to incorporate all of those guidelines into my life. And I
yeah,
don't really have time to think through it either.
yeah,
One of the things that you've been able to help me with personally is number one, is it's not really just a diet because, I think when people think of dieting, they think of, restrictions, being hungry. It's really a lifestyle modification. And I think that's one of the biggest things that I've been able to incorporate in my life, and especially as it goes towards, prepping and planning and that part of it was not really part of my life, but it currently is. So it's been very transformative for me. So I've been trying to figure out a way how to bring you to my patients and some of your insights. So I'm really looking forward to this
yeah.
segment.
I know it's really so. Two things you mentioned, both of them were very, very interesting. Number one is how do you translate guidelines into practice? And sometimes it becomes easy, especially when people are seeing their general physicians or doctors, because everyone broadly knows what to do. For instance, we had a client struggling with gut issues, and one of the things her doctor told her was to go on an elimination diet, which is common when you're struggling with a lot of gut issues. That could be one approach to take. But this was also a person who was an air hostess, and 4 times in a week she was flying. She was midair, and she did not have a lot of control on what she was eating and her food choices. So, as a nutritionist, then it becomes our job to understand that given the client's current lifestyle, what is the best you can do, and translate an elimination diet also to someone who can eat out because she had no choice. um, but that was, that's very important when working with people to understand that where is your starting point, and if they're struggling with something, then how do we start fixing it from the very root cause? And the second thing you mentioned was the importance of lifestyle change. And I keep telling this to people, nutrition is, it has a deadline. I'm going to do this for 3 months, and then once I feel better, I'm going to stop.
Mm.
But diet it has to be, a diet is just a practice of a culture. What a culture eats is their diet, but that's their lifestyle. That's, depending on where you're growing up, how your work schedule is, how your relationship with food is. You want to inculcate lifestyle practices that can just become a part of you. And the extent you're ready to make those lifestyle changes will really determine your health and your wellness and your overall well-being. But just coming back to cancer, I think a lot of the kind of people you see are people who've been diagnosed with cancer, or do you also see people who are looking for preventive measures and looking to take proactive steps to prevent cancer?
I would say both. So I have patients who are at high risk for developing breast cancer, either because they have a genetic mutation or they have a strong family history, they have some other risk factors. And so they're looking for, what can I really do to reduce the risk of developing breast cancer? So and generally during those consultations, we tell them mainly to, stay away from hormone replacement if they're postmenopausal and they have a strong family history, or to, make sure they stay up on their screening. Sometimes if they're at a very high risk of developing breast cancer, then we do additional screening. There are medications that we can give people that are generally hormone blockers, and they're certainly not a popular thing to go to. So, I think that, we are missing a big piece of how to counsel them. And that's how are you living? How are you eating? How are you, what does your lifestyle look like? And that's something I think we don't spend a lot of time on.
Yeah. But it was very interesting when we were having a conversation before, and you said only 10% of cancer is actually genetic. And for us, at least growing up, we've always heard cancer is always genetic, but it's not the case. It's only 10%, which means 90%, 9 out of 10 people getting a cancer diagnosis is not genetics, it's environmental and nutritional factors. And actually, a big part of it is nutrition. Over 35% of the 90% is just what goes in your mouth. But we don't think about this. But I'm glad that people
Mhm.
are looking at taking proactive steps when you talk about, clients coming to you. What aspects of nutrition do you think are they willing to change? What is the willingness to change like?
I think that it depends. I think there's two components. One would be, am I really buying into the fact that it's an issue,
Yeah, true.
right?
Yeah,
I think that it just seems too easy. It's
yeah,
like, you know what, there should be a pill for it.
yeah,
And number two is I think that again, it's more about how am I going to translate, even if I did buy into it, how am I going to translate what I'm currently doing to what would be good for me?
yeah, true. Yeah, I know. And I think it's
So I
also
think that I think
confusing,
that
right? Because every day you hear a
yes.
new nutritional advice when it comes to cancer or any disease management. And especially when you have certain likes and dislikes when it comes to food, you'd always find a group which will agree to those and call that a healthy diet. Let's say that, I love eating cheese and butter. Then there's always like a bunch of people who will say ketogenic diet is the best diet. Let's say I love eating fruits. Then there's always fruitarians who's going to say that this is the only way, to. And because it's so confusing and just so many mixed messages, I think, like you said, it becomes difficult for someone struggling, to look at a cure or look at preventing something to know what direction to go towards.
Yeah. And I think a lot of times what I'll tell patients, because most of the consultation is, I'm not a nutritionist, I'm an oncologist. And so a lot of the counseling is I do a very quick, you know what? These and it's and again, these are things that I just tell people because I think that they're intuitive and there's facts behind it.
Yeah.
Basically staying away from processed foods,
Yeah.
staying away from things that are white, staying away from, red meats, or staying away from um, you know, a lot of the packaged foods that are just easy to
Hyperpalatable
grow.
food. Yeah. Yeah.
Yeah. And so I think that, but those are just again, how would somebody go about taking those few sentences and actually making it a part
Absolutely.
of their
Yeah. Yeah.
life? And I think that's where, working with you, it's about taking maybe one habit and trying to incorporate that one habit over,
Yeah.
so many, taking a habit a week.
Yeah. Yeah. But I remember you asking me, just tell me what are the 5 things I can tell someone, because to make it
Yeah.
easy for them, it's not very complicated.
Yeah.
What are the 5 go-to things which someone can go home and practice straight away? I think the number one, and this again, we'll start broad and then we'll start narrowing down for people so it's easier to understand. Um, when it comes to nutritional advice, it's a combination. Any kind of disease management is a lifestyle intervention, nutritional intervention done together. You can't do one without the other. Um, but the number one would be making sure that you're consuming enough fiber. In fact, with every 5 gram of increase in fiber, just 5 grams additional fiber added to your diet, there's a 10% lowered risk to cancer, which is huge, which is a big number. And there's several meta-analysis, which is multiple studies put together, shows that higher fiber consumption protects you from various kinds of cancers, prostate cancer being one of them, any kind of digestive cancers, breast cancer even. Um, but it's confusing because every time you think of fiber, your mind instantly goes to a bowl of salad, fruits and salads and raw vegetables and raw foods. But fruits and vegetables are so rich in water content, there's not a lot of fiber in there. Um, so you could actually be eating, let's say, like, a bowl of papaya or mango or bananas, but there's about 3 to 4 grams of fiber in, like, a cup of papaya. And your daily intake of fiber, when you want to see those benefits, prevention, is a little over 30 grams. In fact, with my clients, we take it up to 50 grams of fiber per day, which is something you've been practicing too. But if you had to eat papayas or lettuce and salads to reach the 50 grams, you'd be chewing all day. And you can't do that. It's just too much food. The real fiber is actually found in whole grains and lentils and pulses, sort of the dried, carbohydrates, the dried complex carbohydrates is where you find the real fiber. So the first, or rather the easiest thing for someone to go home and follow is ensuring that you have 2 servings of whole grains and 2 servings of lentils or pulses per day. And a serving is about a fistful. Yeah. So let's say you're starting your day with like a slice of brown bread or a bowl of brown rice, or even hummus if you like chickpeas, kidney beans, pulses, sprouts, anything, but 2 servings of whole grains, 2 servings of pulses will get your fiber content up. And that's a good start. And then, yes, you add your vegetables and your fruits, and all of that is absolutely healthy and very rich in micronutrients. But I think fiber is one big start. I remember when we started working together, we really slowly introduced fiber because sometimes it does cause gastric issues. Now, how would you say your fiber consumption is, and what are your top few favorite go-to recipes to get your fiber intake?
I was just thinking so I use a lot of in my food, a lot of chickpeas, and I use
Yeah,
a lot of kidney beans, and then I will do, some whole wheat bread. So and I can make like a hummus sandwich. But so if you were going to tell somebody, tomorrow, what would a good that could meet their 30 to 50 grams of fiber a day, w-
yeah,
what would that look like?
yeah.
Like
I
what
think one essential thing to remember is fiber is only found in plants, just like cholesterol is only found in animals. You don't get cholesterol in plants, a little bit, but not as much. But fiber is exclusively found in plants. It's not found in animals. So the more plants in your plate, the more fiber you're consuming. So that's one thing to understand, that how much of my plate can I start replacing with plants? So let's say you're having red meat. Can I switch that up for something which is a plant, anything which grows in the soil? I think the starting point for someone to reach about the 50 grams is 2 servings of lentils, 2 servings of whole grains, and at least 3 to 5 servings combined of fruits and vegetables. The more, the better. Yes. And like I said, a serving is like a fistful. So let's say you start your day with oatmeal, which is a great option, and try and go for either steel cut oats or rolled oats, a little less processed. And then you have brown rice for lunch, or even whole wheat tortillas if you like, something like a burrito or taco sort of thing for lunch. And I love minestrone soup for dinner. I think just stir fried soba noodles, because soba noodles are made from buckwheat, which is again a whole grain, with a lot of vegetables would be a great option. Depending on the kind of cuisine, if Indian food, which both of us really enjoy, then kidney beans, chana masala, that kind of thing, which is a curry, any form of dals mixed with brown rice, or dals with whole wheat chapatis or fulkas is a great option. Um, Pasta is a great option. You just want to find whole wheat pasta, whole
A
grain
whole wheat
pasta.
pasta.
Yeah.
Okay. So
Yeah.
those pasta lovers don't have to
Yeah.
necessarily give up their
No,
pasta. They can
it's whole
just
grain.
switch what
Yeah.
kind of pasta they're using.
Yeah. I
Okay.
think we
And I
also use a
see,
lot of lentil-based pasta, which is a fantastic option because it's so low GI, great for um, even people struggling with weight-related issues or diabetes. And you want to stay away from whole wheat because wheat can cause disruption, gut dysbiosis to some people. Then
okay.
lentil-based pasta is a great option. With the show notes, maybe we can attach a few, fiber-rich recipes, which people
I
can,
think
and
that would
even
be
write
great.
the
Yeah.
amount of fiber in per serving.
I
Uh,
think that would be great. Yeah, I think
yes,
that would be really helpful.
yeah, yeah. So
Okay.
people start getting an understanding of how much they
Okay.
should be consuming. Yeah,
Okay. So what I'm hearing is the number one of the key things is just getting enough fiber in your diet.
absolutely.
It's fiber is highly it's generally in plant-based foods. You don't have to really you can still enjoy a lot of the foods that you like, but just
Yeah.
trying to find those substitutions that have a lot of fiber in them. So oatmeal, any wheat-based products, even for pasta, using kind of like a wheat-based pasta.
Yeah, yeah. And for someone looking at a little bit of science, fiber is also what binds to excess sex hormones and helps you flush them off the body. So let's say, especially in the postmenopausal phase, when you're, or the perimenopausal phase, when you're struggling with, fluctuating levels of sex hormones, sometimes estrogen dominance, so conditions like estrogen dominance is a huge contributing factor to breast cancers. And when you're trying to sort of just reach a hormonal balance, um, your body has a natural mechanism through something called SHBG, sex hormone binding globulin, via which the sex hormones get attached and flushed out of the body. But obesity reduces SHBG production. So let's say you're struggling with obesity, you're not making as much SHBG, so you don't have these binders to get rid of sex hormones. The second alternative through nutrition is fiber. As long as you're eating enough fiber-rich food, sex hormones bind to the fiber, and it helps you with hormonal balance. So especially in the perimenopausal, postmenopausal phase, it becomes even more important that you're consuming adequate amount of fiber all through your life, but especially during that phase. We've noticed with many clients, just fixing this one part fixes a lot of other things, even skin health and hair health, because many things are due to your gut health, constipation and gastric and loose stools, any kind of gut dysbiosis. And what fixes gut dysbiosis? Fiber. And people start getting into the, but what type of fiber should I have? The soluble, just have fiber. Does not matter what source you're getting it
Yeah.
from. um, Everything has its benefit. Just make sure you're eating enough whole grains and lentils, the kind of foods which we start villainizing because they come under the category of carbohydrates. But carbohydrates is broad. Of course, avoid sugars, and sugars you don't want to consume like table sugar. But a broccoli is also carbohydrate rich. Yeah, so you want to make sure you're still consuming whole grains and lentils. Yeah.
That's a really good point about the sugars, because a lot of times patients will come to me and say, well, I'm just going to stop eating sugar
Mhm.
and that will starve my cancer. But that's such a simplistic statement, just like what
It is.
you're referring to,
Yeah.
because it's not that simple. And there's a lot of great foods, and a good diet plan or a
Yeah.
good nutritional plan, I should say,
Yeah.
is not just about sugar, but it's a very broad sort of
Yeah.
global plan.
Yeah, it's really very interesting also because if something were to, be blamed for cancer, I would say It's saturated fats and one specific kind called uh, uh, palmitic acid, which is essentially found in a lot of junk food and palm oil, because that
Okay.
triggers the activation of a certain receptor in the body called CD36. And activation of CD36 metastasizes cancer. So, it makes your cancer worse. If there was one food group, because sugar, yes, sugar, but sugar has so many nuances. Like a fruit is also considered sugar, right? Um,
Right.
but in this case, fruits also have a lot of antioxidants and um, uh, beneficial, nutrients and minerals, vitamins, which are important and essential for your body. Dates would also be considered sugar, right? Technically, it's sweet. So people get confused when we say sugar. Should I have stevia instead of white sugar? Is brown sugar okay? Is coconut sugar okay? And it can get complicated. And what we suggest to clients mostly is just stick to as close to whole foods as possible. So let's say you're getting a fruit, you're also getting the fiber and the phytonutrients and all the beneficial properties of the fruits. Sorry, you're not just eating the fruit. Yeah. Um, don't You don't have to stop sugars in the form of fruit, but of course table sugar avoid. But if there's one thing you should absolutely avoid, it's saturated fats, and specifically saturated fats coming from hyper palatable food like processed and packaged food. Anything you see which is packaged, which has really long shelf life, will have some sort of stabilized or saturated fats, and that's what's making cancer worse and feeding your cancer cells.
So there's two questions that I have from that. One is, so one of the things that I've seen people do is look at ingredients,
Yeah,
on a product and basically say, okay, if there's, more than two or three ingredients, probably not a good product. So how
yeah,
do you look at, it's very hard as people are so busy and
yeah.
it's very easy to just pick up something. So
Mm.
how do you kind of navigate through that maze of,
Yeah.
what should I stay away from? Do you have a kind of a process by which
Mm.
you do that quickly?
Yeah, I think that's when you need a nutritionist, and that's where professional help is needed, because they start, you delegate the responsibilities to someone else and they help you make the decisions. Um, I wish the answer was don't shop for products uh, which have an ingredient label. Like an apple will not have a nutrition guideline; it's not going to have a label.
Right.
I wish,
Yeah.
but all of us live busy lives, and all of us don't have the time to cook all three meals and snacks and everything. So I remember many times in our discussion, we've come up with snack options which you can carry along with you and which you can have when you're traveling, and it's convenient, and that's what it's for. And I think we should take advantage of the right ones. Versus, if I were to choose just a few ingredients to look out for, it would be fats, specifically saturated fats and trans fat. Ideally you should be consuming 0 grams of this per day. Ideally it should be zero. You shouldn't be consuming any saturated or trans fats. And when you look at an ingredient label and see something is very high in saturated fats, um, then that's not good for you. I'll give you an example just with, let's
Yeah.
say, olive oil, which we would consider as fat, and coconut oil, which also would be fat. But when you look at the saturated fat content, coconut oil is about 50% in saturated fats. It's very, very high. Um, Ironically, ghee, which is clarified butter, is about 80% saturated fat. It's very, very high in saturated fats. But olive oil has about 15% saturated fat. It's much lower. Still has saturated fat. So it's probably not as healthy as, broccoli or like vegetables, but it's still lower compared to like coconut oil or olive oil, coconut oil or clarified butter or ghee. So I think if there was one thing which I would look at the ingredient label is what is the saturated fat content, and ideally you want to stay as close to zero as possible. Some of
That
the other
sounds
things which
good.
I want to look for is food coloring. Food coloring has been studied and associated with ADHD, especially in kids, and many sort of anxiety and behavioral disorders. And this is easy to mask because it'll be something like NH157, and you don't know what it is. So I think,
Mm.
when you're looking at an ingredient label and you don't identify a lot of the ingredient names, you probably want to avoid it. I remember having this discussion also, where a client of mine came with a, a health bar, and the ingredient label was just dates and nuts, nothing else. And they labeled themselves as being this, really clean bar and no hidden ingredients, etc. And the shelf life was 9 months. And I was just telling the client, if you prepare a date and nut bar and you keep it on the shelf at home, it's going to go bad in a week. You can start smelling it. But the shelf life of this product was 9 months, not refrigerated on the shelf. And how are they managing to do that? So there are ways by which brands can get away by adding a lot of things, and they can still escape the FDA regulations. And you want to be a little bit conscious and aware of that. So stick to making food at home as much as you can. But then, like I said, work with a nutritionist who can help you navigate through the labels. I don't think the profession in general is given as much limelight as it should be given, but nutritionists do a lot of work in terms of helping you sort of organize your meals and understand how busy you are, how much time you have, what is your inclination towards cooking, do you like it, not like it, what are your taste buds like, what kind of food, because all of us have different preferences. Like, I know you love waking up to oats in the morning, and you love like a more sweet breakfast, and I love like a crunchy and savory breakfast. And these things need to be kept in mind before you create, making someone's nutrition plan, because you're more likely to follow it. And that's what a nutritionist does. So at least once in a year, work with someone sort of to just get your day and let them make the decisions, because they would have gone through a lot of labels to help you understand what is right and wrong. Yeah.
That's good. I think that is one thing I have changed. I do not fill my shopping cart with anything processed. It's
Really? Yeah.
generally,
So nice to
yeah,
hear that
yeah,
from how.
yeah. And but because I'm so busy, is I spend a lot more time on the weekends
Yeah,
prepping my
meal prep.
food.
You
So
always need to. Yeah,
yes,
yeah. I
yes.
think you've got that.
And
But now, just how much time does it take you to meal prep? Just to give people an understanding that it's really not as hard as, you know.
yeah, I spend a few hours on either Saturday or Sunday doing it, so making things in bulk. If I'm gonna have a smoothie, I pre-package everything, put it in the freezer so I can just grab it and go. In fact, I bring the smoothie packet is really not just a one person packet, so I bring it to my office staff and make them drink it. So I
That's
um
amazing.
yeah, so
Yeah,
and I think my entire staff has gotten more healthier just
that's
watching what
amazing.
I'm
Yeah.
doing. So when we order lunch, I generally don't participate because I already have my own lunch. So that's a change for me. I'm not used to planning. I'm used to just grabbing and going
Yeah.
because that's kind of what, you know, you tend to, that's kind of the MO that I've always had for myself. So it's very different, and it is, I feel that those around me really are inspired too. So, but I think the key is knowing, what are you packing? What are you eating? What are the foods,
Yeah.
and I think that's why um this relationship is so powerful to me, because it's not just something I'm going to do for 30 days, but it's really changed my life. I don't think, I've been working with you for a couple of years, and obviously it's not, I say I've spent so many years accumulating bad habits. It's not
Yeah.
something that you can just reverse in 3 months
Yeah.
either, right? So you have to give yourself a break and say, okay, you know what, yes, I'm going to, I'm not going to be perfect, but I am going to be persistent about getting myself to a healthier place.
Yeah. I
Yeah.
think what a lot of people also have a misconception is, if it's going to be healthy, it's not going to be tasty.
Yeah.
Because every time someone even talks about diet, the word is just so misused. People think it's going to be restrictive. I'm going to be hungry all the time, and the food is going to be very bland and not tasty. But contrary to everything you're doing, we haven't discussed ever in terms of portion sizes or how much you're eating. It's just, as long as you're eating right, you're doing right. And
Yes.
even the kind of food you eat, when sometimes you send the pictures, it's so colorful. It's amazing just to look at, so it doesn't have to be boring. It doesn't have to taste bad. And it's not going to be your lifestyle unless you really genuinely love what you eat. The only way you'll make it a lifestyle is if you look forward to your meals and you have a positive relationship with your food. How has yours changed over the years? Because I know it's been
I
quite
eat
a
a
journey.
lot. Yeah, I eat a lot more fruit.
Yes.
I
Yeah.
eat, like I said, I don't eat packaged foods anymore. If I make my own trail mix, I make my own snacks, and I find I feel better too.
Yeah.
So just for those people who are diabetic, I do use a sensor, it's a continuous glucose monitor. I like it because, and I always tell a lot of my diabetic patients, I'm very pro those sensors because it
Mm.
allows you to see real time what is the food that you're doing, what that you're consuming, what is it doing to your blood sugars. And so I personally I use the Libre, but there's different ones out there. Um, and I love it because I notice if I do, pick up something that's processed, that will, I will see the results of that for, even, for several hours
Yeah.
after that.
Yeah. Yeah.
And you see
Exactly.
that, your blood sugar has a harder time coming down. So I love being able to see what I'm doing because I think that's one of the, I would say, obstacles about nutrition is you don't get to necessarily measure, right? Are you
Yeah.
eating well? Are
Yeah.
you not eating well? But I think that this is one way that I have found to be very gratifying because I can see, what doesn't even raise my blood sugar and what
Yeah.
really takes a toll on my blood sugar.
Yeah.
So I know that what I'm doing works because when I am very good about following it, my blood sugars are very, very low and they stay low.
Yeah,
Yeah.
I know. And
Yeah.
I'm glad you
Yeah.
mentioned that in the same breath as you mentioned, I love fruit because the big misconception is you're diabetic, you can't eat fruits. But you absolutely, it's not even a question of if you can eat it or not. It's actually healthy for you and doing good to your body, which is amazing. One of the things which I saw on your website, which I so resonated with and I loved, and I always love talking to you so much because I always learn something and I inspire to be like you, um, was when you're
Mhm.
meeting people to be able to give them back that, you feel like you're losing control over everything and to be able to give the control back to them. Um, how would you empower someone who's just been diagnosed? Because it's very scary and it seems like the end of the world. And of course, cancer itself has advanced so much now, and we have so many different treatment options, but it's still a very scary word. So
For
what
sure.
would your tips be to someone, who's just been diagnosed?
So usually our consultation is very varied, right? Because there's just so many different ways somebody can present. Um, Emotionally, not everybody is in the same place. But I think, it's true. One of the scariest parts is that you really lost some control. And I think that's what is so scary. You don't know what's coming. You don't know how things will progress. You don't, and um, and so many patients will ask me, how do I eat different? Because that is something that not only I think people feel like, okay, there's something proactive I can actually do. So I think deep inside, everybody knows that, hey, this is a big component of
Yeah.
what I can do differently, right? And they look to either, what can I do from a nutritional standpoint? What can I eat? What do I stay away from? And so currently, like I said, I give them those few tips. And then if they need to, if they're diabetic or they have, very high A1Cs or if they're obese, it's unfortunately not the right time to be
Yeah.
discussing all those things. Sometimes if they're, uncontrolled with their diabetes and it's going to interfere with their surgery, then I have to address it, because I can't take people to the operating room without having their blood sugars controlled because it interferes with
Yeah.
wound healing. So, but the other things that are just not quick fixes, you have this fire in the room and
Yeah.
you have to put out the fire, but it's something that is just so important. And that's one of the reasons this has been my longstanding passion, is to have some advice for patients, because yes, we're going to take care of this cancer, but you have more control than you think you do.
Yeah.
And I think everybody recognizes lifestyle, which includes nutrition, exercise, how you live, how you deal with stress, are all things that probably contribute to how our bodies, react, and
Yeah. Yeah.
and how we heal and
Yeah.
how we recover, and the risk of something coming back.
Yeah.
Um, so so I think, to answer your question, is we don't spend much time on nutrition, because the initial consultation up until their treatment is finished is really focused on getting those patients through their treatment successfully.
Yeah. Yeah. And I think that's when nutritionists, when we get clients who are undergoing treatment or who have gone through chemo and radiation and then post that, because nutrition at every stage will differ. Nutrition will differ when you're going through chemo. Nutrition will differ when you're looking at prevention, versus a year later when you're trying to regain the muscle mass, because you lose so much during the process of chemo itself. And nutritional practices will differ. But when we were sharing notes and we wanted to, sort of bring attention to one, prevention and Mediterranean type diet, basically a lot of fruits and vegetables and whole grains and lentils and pulses, has shown time and again through multiple studies that can be preventive measure for cancer. So the sort of, if someone wants to start taking control of their health, then trying to understand, okay, these are the aspects of the nutrition I need to focus on, and these are the aspects which can probably put me at risk from a carcinogenic, what you're putting in your mouth. And the only thing which again I came across when it comes to regression of cancer was one study which was by Dr. Dean Ornish, who tries to use a whole food plant-based diet. It was a small scale study, not very large, but it showed positive results. And I think that was another beautiful thing, that again, for people to even grasp the concept of what is a whole food plant-based diet. And plant-based just sounds like I'm not going to be able to eat meat and dairy and eggs and all the foods which I'm used to eating right now. But then what do I eat? Where do I get my proteins from and calcium from? Um, but there is enough resources available online. We'll probably leave a few links below for people to also understand. The just the feedback is, try to see if you can make your plate with more plants, and everything else from a taste perspective. If you're trying to get your proteins from, for instance, eggs, you're not getting it from eggs. You have plant-based alternative. If you love eggs, sure, from a taste perspective, include it a few times in a week. But you can still, get all your nutrients from the plants you're eating. Um, and even if you can't afford for a nutritionist on board, we still want to ensure that as long as you're eating enough calories coming in from plants, you're getting your micronutrients. Most people are not, except for B12 and D3, the only two nutrients which you don't get on really any diet, because it's from sunlight and from soil. You're getting your nutrients as long as you're eating enough calories, and also something that's healing your body. Um, so the takeaway would be, number one, high fiber. Number two, try to see if you could reduce. We talk about saturated fats being to a minimum. So when you're checking the ingredient label, making sure there's no saturated fats, and limiting the consumption of oils. With clients, we try to do 1 tablespoon per day, no more than that, and try to stick to something like olive oil, which is lower in saturated fats, avoiding the coconut oils and the palm oils and clarified butter or ghee, avoiding that. But the other thing which I think would also be very, very beneficial is trying to get your protein sources from plants, because especially during chemotherapy or right after, you want to make sure you're getting adequate amount of proteins into your diet, and just switching up the animal protein for plant protein. So even let's say one serving of tempeh per day or tofu um, um, is enough, is great in terms of. And if you don't want to have soybeans, then chickpea tempeh and mung bean tempeh, and these are readily available in the market. So trying to, getting at least one serving per day, and then your vegetables and fruits and adequate calories will help with most people get their protein intake also for the day.
So let's say that, the common things I hear about tofu and tempeh is I can't stand the way that tastes because it is tasteless.
Yeah,
And
I
so
hear you.
maybe one of the things that we can do is maybe share a recipe of how to
Absolutely.
make tofu taste better.
Yeah.
I think that that would be, I think, more impactful than um, saying it. And then what are your thoughts about, this is a question that I get oftentimes is soy and breast cancer,
Yeah.
because there are conflicting studies showing that you shouldn't have too much soy, and now we're talking about tofu, so which is
Yeah.
soy based.
Yeah. So let me try and explain this and also keep it to something that everyone can understand. Phytoestrogens, a specific type of isoflavones or a specific type of antioxidants which are found in soy is phytoestrogens. Now, phytoestrogens act like estrogens in the body. So let's say an estrogen can be beneficial and harmful. Estrogen helps with your bone health. Yeah. So let's say you don't have enough estrogen, especially in the postmenopausal, women are at the risk of hip fractures and osteoporosis because your bone health can go downwards if you don't have enough estrogen production in the body. Estrogen too much can also lead to cancers like breast cancer. Um, so you want estrogen just enough. You don't want too much of it. You don't want too little of it. Now, let's say you have too little estrogen, and that can be bad for your bone health, and you consume soy, then the phytoestrogens will go and occupy the receptors where estrogen is supposed to occupy, and it's going to promote bone health. It's going to act like estrogen in the body. But let's say you have too much estrogen, and if estrogen goes and settles in your receptors, specifically in the breast, then that can lead to cancers. And you don't want estrogen here. In this case, phytoestrogens are going to go and occupy the receptors before estrogen can get there. And this way, estrogen cannot occupy those receptors and it protects you against cancer. So we also see many studies showing soy consumption and reduce risk of cancer, specifically breast cancers. And that's why conflicting studies, because many studies show that phytoestrogens act like estrogen. Yes, in the case where you need, when there's not enough estrogen in the body and improve bone health. But there's times when phytoestrogens protect against too much estrogen in the body, like in the case of breast cancer. Um, my When I'm suggesting clients, I want to make sure they're consuming good quality soy. So you want to make sure that it's, not genetically modified and it's organic and you have good quality soy. And you're also not consuming processed soy in the form of mock meat specifically, because that's very, very processed. Um, and that can do more harm than good. But let's say you're consuming tofu and tempeh and soy milk. These are minimally processed, or even soybeans, edamame, boiling it and adding it to your salads and making curries or just adding it to your soups. Not very difficult to do. These are healthier, minimally processed soy forms, which I highly suggest everyone to consume. We've specifically, because I've been practicing nutrition for a very long time now, people who consume soy products in their 20s and 30s, an adequate amount of soy products, have a very easy time during menopause, which can otherwise be a very, very difficult, period for any women, because hot flashes and you have irregular cycles and excessive bleeding and so many problems. But women who consume high soy products, and especially in Japan, or what Japan used to be before industrialization, do tend to do very good during menopause. And my mom was the same. We consume a lot of soy products at home in general. And my mom's menopause just came and went. There was no menopause period at all. Like she didn't, and we were very prepared for it because I was working with clients and we see clients with hot flashes and struggling. So we had like all the multivitamins ready and everything ready, but she didn't have it just stopped. It was just so simple. So I think that's really interesting to see. And I encourage everyone to eat minimally processed, good quality soy products.
That's a good
Yeah.
point. That's a good point. What I have had, is there, so if someone has a diagnosis of cancer and, most breast cancers are fed by estrogen, you're saying that, soy is safe. Is there an amount? Is there, are there
Yeah.
guidelines around it, or is that, what's your thoughts on that?
Yeah, there's actually been studies done. Up to 2 servings per day is recommended. And you start seeing like with anything of too anything, even water and too much is not good for you. So anything, but I think up to 20 cups of soybeans is still very, very safe.
20
20
cups
cups.
of,
Yeah,
okay,
no one
let's,
eats that. Yeah. Yeah.
okay. Yeah.
I think the only
Okay.
problem which is probably with any beans, any kind of, beans like mung beans or kidney beans, don't eat raw because it has phytic acid, which is an anti-nutrient. But I don't know anyone who eats raw soybeans. I don't think
Right.
you can. Yeah, unless you're making like a soybean flour and maybe making like tortilla or something out of it. But just
Sure.
don't eat raw soybeans. Just cook it before you eat it. Even
Okay.
for people with thyroid, because goitrogens is a concern, and goitrogens is a compound that prevents the absorption of iodine in the body. And
Okay.
goitrogens are high in soy products. So one of the recommendations for thyroid clients is, don't eat soybeans. But again, goitrogens are destroyed when you cook or when soy is exposed to heat. Just don't eat raw. You're fine as long as you don't eat raw. Yeah. Do you have a favorite tofu dish? Because we're on this.
I do. I usually take, I make a lot of kind of sauces so I can eat it with my brown rice. So what I usually do is I take the tofu and I actually air fry it.
Yeah.
Sometimes I'll saute it with you know, some soy sauce or um and then put it in the air fryer for about 20 minutes.
Yeah.
And then I just cut that up and put that in my in whatever, even in soups. I put it in
Yeah.
soups, I put it in my, sauces, because I do like tofu if it's cooked right. I'm not a
Yeah.
big fan of just raw tofu,
Yeah.
but
Yeah.
yeah,
Yeah.
I do like it air fried.
Yeah,
So
yeah, I know. I love tofu and so many different types. If it's an Indian gravy or an Asian gravy, and there's so many. Tofu takes up the flavor of whatever you're cooking it in. I think it's just finding the right spices to cook it with, and it's not that hard to eat. Yeah,
So here's a question for you. How do you know if you're getting, I think getting enough protein is
yeah,
a big
absolutely.
concern.
Yeah,
So how do you know if you've gotten enough protein for the day? Like,
yeah,
what's the metric or easy sort of way to
calculation.
assess that?
Yeah,
Hmm.
absolutely. So when it comes to protein, we are so obsessed over how much protein we are getting versus how much protein are we absorbing in the body. And what increases the bioavailability of protein, or rather how much we are absorbing or retaining in the body, is getting nutrients like bromelain, which is found in your vegetables and your fruits, and a lot of the side dishes which we don't give a lot of importance to. That is important. The second thing is too much protein is not necessarily good for the body from two perspectives. Number one, like with carbohydrates, excess proteins is converted to body fat. So if you're taking too much of proteins, you are converting, and it is still calories. So it's converted to body fat. And number two, excess proteins is excess work for the kidneys to filter out, because kidneys play a huge role in flushing the proteins out of the body. So if you're taking too much, which your body does not require, then your kidneys have to work overtime in terms of filtering out the excess protein, and that's not healthy either. But when it comes to the consumption of protein, I'd like to, and this would not make sense for a lot of people, but I'll still say the grams. we want to go 1 gram per kilogram body weight, not per pound, per kilogram body weight. Yeah. So let's say that if I'm 50 kilograms, the protein I should be consuming is roughly about 50 kilograms. There is
And
some,
just to clarify, we do everything in pounds. So
really, yeah,
it's
yeah.
yeah, so every kilogram is 2.2 pounds.
Every kilogram is 2.2 pounds. Yeah. So that would be much lesser in pounds. I want to say it comes up to 0.5 grams of protein, or a little bit lesser than that but my calculation might be wrong. So let's just stick to kilograms.
Yes, yes, yes.
One
I just wanted to
kilogram.
point
Yeah.
that out for people
Yeah.
who are listening
Yeah.
to make sure
Um,
they convert.
Yeah, no. And there is also some science to say that as we start growing older and we're looking at different metrics, let's say we're looking at diabetes or chronic disease prevention, you want to take that number to 0.6 to 0.8 grams per kilogram body weight, which is slightly less
Okay.
than what most people are consuming. But how do I get the 1 gram per kilogram body weight? Now, let's say someone's on a plant-based diet. Easiest calculation method, like we said, anyways, for the fiber requirement, you want to consume 2 servings of whole grains and 2 servings of lentils per day. And assuming you're doing the 2 servings whole grains and 2 servings lentils, and one additional serving of something which is a little bit higher in proteins is soy products. 1 to 2 servings of soy. And most people, along with this, you're going to eat your fruits and vegetables and different things. Most people should be able to reach your protein, number for the day. Of course, you'll have to work with a nutritionist, especially let's say you're obese and you're trying to follow a low calorie diet plan. The only time you probably are not reaching your protein requirement is if you're very, very low on calories and you're trying to go, the 1,200 calories, which no one should anyways. But let's say you're going very low calories, then it's harder to reach your protein requirements because you're trying to stay within a certain limit. But as long as you're eating adequate calories for your body weight, you probably are getting enough proteins. Or working with an expert will give you a little bit more clarity. Or easy calculation is 2 servings whole grains, 2 servings lentils or pulses, and 1 serving of tofu, tempeh, whatever form of soy products you like. Serving size being roughly about your fist size.
Or if they want to substitute that for any kind of meat, it's basically the 1 gram per kilo,
Kilogram,
correct?
yeah. Yeah, 1 gram
Yes.
per
Okay.
kilogram of body weight. Yeah,
Okay.
approximately. I think I've met more people who are not consuming adequate amount of nutrients to help with protein absorption than people who are not consuming enough proteins. Most people are getting enough proteins, but a lot of people are not getting enough nutrients that help with protein absorption, digestion, and all of that. Yeah.
So if there was one thing that could help, 1 or 2 things that you can give advice on how to increase that protein absorption, what would that be?
Well, there's multiple factors. Number one is protein absorption goes up when you actually have place to. So let's say I'm not weight training or resistance training. Doesn't have to be going to the gym, but even yoga, or I know you love CrossFit, so CrossFit or any form of training where I'm challenging my muscle fibers and there's wear and tear of muscle fibers. My body is going to require protein, and then protein absorption goes up. But if I'm consuming protein powders and I'm not training, then the body doesn't need it. There's no need for proteins. Besides that, making sure that you're consuming fruits like pineapple. Pineapple is very rich in bromelain, and bromelain helps with protein absorption. So
Okay.
citrusy fruits like that is, I think, a great option to go.
Okay. Okay.
Yeah.
And this may be a silly question, but do you do it at the same time you're eating your protein, or how does
No,
that
you
work?
don't have
Not
to. No,
necessary.
no, you don't have
Okay.
to
Okay.
necessarily. Um,
Okay.
enough we call it plant points. You're getting
Okay.
enough, and ideally you want to aim for 100 is a very good number, which is 100 different varieties of plants per week. I'm going
Okay.
to give
That
you
sounds like a lot. Yeah.
that's like a lot, but that
Okay.
includes lentils, pulses, whole grains, vegetables, fruits, and spices, and nuts and seeds and everything. And a lot of us are not eating enough plants. And if you
Mhm.
can get to the number of 100 per week, you're getting so many micronutrients. You're also getting all of these things which fix your gut health, which promote the growth of the good bacteria in the gut and reduce the inflammatory bacteria, has to be a plant point. So it has to come from a plant, and it has to be as close to the whole food as possible. So almonds would be a plant point, but almond milk wouldn't, because you're removing the fiber from the almond. It's not a whole food anymore. Olives would be a
Gotcha.
plant point, but olive oil wouldn't. Yeah.
Okay.
Yeah.
Okay. Okay. Okay.
Okay. Do you want to give us a gist of what can we expect in the next podcast? What do you want to talk about next?
I think that it would be kind of fun to talk, maybe going over, what I thought was super helpful when you started putting a meal plan together for me
Yeah.
was the science behind it. I really, really liked it because I would read, because being a scientist, right?
Mm.
I would read the articles that you would hyperlink
Yeah.
it with.
I'm
And
so
I
glad. I'm so
loved
glad. Yeah.
looking at the why,
Yeah.
and because if I know the why, I'm highly likely to do it,
Yeah.
then just think, okay, why am I really doing this, right? Because it also allows you to um go, okay, now I understand, like I don't need somebody to meal plan for me anymore. I kind of know what I need to do. I know, what I should eat, when I should eat it. Because I think another thing that you have really instilled in me is it's about timing, right?
Mm.
Timing of eating and intermittent fasting,
Yeah.
and why that's important.
Yeah.
So maybe we could
Yeah.
do
Should
something
we do
like
the
that.
top five whys? Top five foods to
Yes.
include and the whys?
Yes. I
Yeah.
love it. Yes.
Yeah.
Let's
And
do
then maybe
that.
you can share your favorite recipes on each one of them, because I'm pretty
I
sure
can
you're
do
doing.
that.
Yeah.
Yeah. Yeah. I can do that.
Yeah, that
I
would be
can do
fun.
that.
Excellent.
Okay.
I think this went really well. Thank you so
I
much.
do too. Yeah. No, thank
And so
you. I
I
think
think,
this was really helpful.
yeah, I'm just gonna stop
Okay.
recording now, and then we can
Okay.